Vinod Kumar from Kerala, Asghar Ali from Delhi, Krishna Kumar from Bihar. These are just a few names out of the thousands of patients who die each year in India because of fake doctors. Indian Medical Association IMA indicated that there are around 500,000 fake doctors that operate in the country. However, other reports suggest that the real figure is almost double the official figures at around 1 million.
With the Kerala fake doctor case, and there is an unqualified doctor who has been arrested.
The unqualified practitioners of medicine.
ऑपरेशन करने वाले डॉक्टर राजेंद्र प्रसाद शुक्ला 8वीं पास हैं, इनके पास कोई डिग्री नहीं है.
Police have busted a racket involving doctors who were conducting surgeries without the requisite degrees and permissions at the Agarwal Medical Center in South.
फर्जी डॉक्टर अगर आपकी सर्जरी कर दे तो सोचिए कि क्या हुआ. वैसा ही असगर अली की मौत हो गई 2022 में गोल ब्लैडर की सर्जरी.
करीब हमारे पास पीछे 6-7 कंप्लेंट तो हमारे पास कम से कम आई हुई हैं, जिसमें से 2-3 में हमने इसके खिलाफ एक्शन भी लिया है.
Mumbai crime branch busted the bogus Ayurvedic doctors racket. Time that Mumbaikar needs to be stay away, and they needs to be stay aware, because this kind of incident where educated people are getting dragged by the illegal doctors which are roaming everywhere in the city.
Now in Kolkata in West Bengal, the next time you are ill and have to go to the hospital, be sure to ask the doctor for his certificates. While fake doctors are crawling out literally from the woodwork, some from Kolkata's best known private and government hospitals.
Krishna Kumar, a 15-year-old boy from Bhuvalpur in Bihar, had many dreams, but his life took a tragic turn. His family lovingly called him Golu. On September 4, 2024, he felt sick with vomiting and stomach pain. So his family took him to a Ganapati Seva Sadan, a clinic run by a self-proclaimed doctor named Ajit Kumar Puri. However, after receiving some medication, Golu was advised to have urgent surgery. Therefore, Puri sent Golu's father to get diesel from a local fuel station and began the operation without the family's consent. But the situation became alarming when it was revealed that Puri was performing surgery while watching YouTube videos on his phone. Therefore, he had no formal medical training or experience. During the surgery, Golu's condition worsened significantly. But when family members expressed their concerns about his pain, Puri sarcastically dismissed them by saying, "Am I the doctor here or you?" After the operation, Golu showed severe signs of distress, so Puri arranged for an ambulance to take him to a better equipped hospital in Patna. Unfortunately, Golu died on the way. Upon realizing their son had passed away, his family found his body left on the footsteps of the hospital where he was supposed to receive further treatment. Meanwhile, Puri and his staff fled the scene immediately. Later, police investigations revealed that Puri had no medical qualifications, and this lack of expertise directly contributed to Golu's tragic death. Watch this video from Bihar where the man claims he's a doctor without a degree.
एलोपैथ का प्रैक्टिशनर.
एलोपैथ की प्रैक्टिशनर
जी.
डॉक्टर हैं आप?
जी.
कहाँ से पढ़ी आपने डॉक्टरी?
हम पढ़े नहीं हैं, प्रैक्टिशनर हैं.
मतलब दवाई देते हैं?
हाँ, देते हैं. मेरे पास डिग्री नहीं है.
हाँ.
प्रैक्टिशनर हूँ. बहुत हमारे जैसे बिहार में छाए हुए हैं, गांव-गांव में छाए हुए हैं. मैंने किसी डॉक्टर के यहाँ जाकर सीखा और सीखने के बाद में काम शुरू कर दिया.
He explains in the video that there are many doctors like him who treat people and give out medication without any formal qualification. Can Indians really afford a doctor? Healthcare costs in India are low compared to many developed countries, but a lot of people still find it hard to pay for necessary medical care. Therefore, even though medical services might be cheaper, many families struggle to afford them. About 60% of healthcare expenses in India are paid out of pocket by patient, but this means that many do not have access to medical insurance. Therefore, this creates a heavy financial burden for families. As a result, around 39 million people fall into poverty each year, because of medical costs. Listen to this video by Al Jazeera English.
It's difficult for women and children to go out to the health center or the hospital, which are quite distant. If they go out, they would end up wasting at least 3 to 4 hours. So if we are able to bring these camps to them, then a greater number of women and children will be availing of these services.
The doctor to patient ratio in India is about 0.7 doctors for every 1,000 people, but this is much lower than in countries like China. Therefore, there are not enough doctors to meet the healthcare needs of the population. With a per capita income of around $1,500 each year, many Indians cannot afford even basic healthcare without going into debt. Therefore, the average household spends about 5.8% of its income on medical care, which can be really difficult for those who already have limited resources. Thousands of people could die without this hospital.
यदि ये अस्पताल नहीं शुरू करते थे तो हजारों लोग और मरते थे, जवान लोग मरते थे, गर्भवती महिलाएं मरती थी, छोटे बच्चे मरते थे। हमारा हमेशा प्रयास रहा है महान ट्रस्ट का और मेरा कि हम आखिरी जिंदगी के आखिरी क्षण तक मरीज को बचाने की कोशिश करेंगे, चाहे कुछ भी कितना भी गंभीर मरीज हो। हमारे पास साधन है नहीं है। सैकड़ों लोग हैं कि जो अनाथ होते हैं, अकेले होते हैं, कोई बेसहारा होते हैं, उन सब लोगों का इलाज हम गरीब आदिवासी लोगों का इलाज पूरी तरह से फ्री ऑफ कॉस्ट करते हैं, चाहे सर्जरी हो, चाहे कितना भी क्रिटिकल बड़ी बीमारी।
India only spends about 3% of its GDP on public health care, which is one of the lowest rates in the world. This underfunding means that facilities are often inadequate, but high costs for private care make it even harder for low-income families to get the care that they need. Therefore, the overall healthcare system faces significant challenges. Why is there so many fake doctors in India? The problem of fake doctors in India is serious, but it can be explained by several connected reasons. There is a lack of regulation. The healthcare sector in India often lacks strict rules, but this makes it easier for unqualified people to work as doctors without the right credentials. Therefore, many can pose as medical professionals without training. India has different medical systems such as allopathy, Ayurveda, and homeopathy. This can blur the lines between qualified and unqualified practitioners, but it allows untrained individuals to take advantage of the situation. Therefore, many people may not know who to trust.
Ayush doctors, doctors who practice Ayurveda, Siddha or Homeo, who are unallopathic, unqualified doctors who are not just practicing but were caught in the ICU, in the intensive care. They are not specialists, they are far from qualified to be in the ICU, and yet they double up as critical care providers. This is a blatant violation of the law.
The population of India is multiplying. This increases the need for healthcare services. Therefore, there's the shortage of qualified doctors in many areas, leading people to seek help from anyone they can find, even if they are not qualified. In rural and underserved regions, people often have limited access to real healthcare providers, but they may turn to anyone offering medical help. Therefore, this can lead them to unqualified practitioners.
आज के डेट में जो कि बचाए हैं गांव के आदमी को, नहीं तो ये लोग गांव के आदमी नहीं बचते हैं। अच्छा। आरा में कोई डॉक्टर बैठता नहीं है, नहीं वहाँ सदर हॉस्पिटल में कोई व्यवस्था है।
पटना रेफर करता है, वहाँ पर सुई दे के मुआ देता है, बॉडी नहीं देता है, और क्या है?
तो इन्होंने आपको बचा दिया है?
हाँ, हम लोग को यही बचाया।
The medical field can offer high earnings, but this can tempt some individuals to pretend to be doctors without proper training. Therefore, the desire for money can lead to more fake doctors. Many patients do not know how to check a doctor's qualifications, but this makes them easy targets for fraud. Therefore, they may trust fake doctors without realizing the risk. In some communities, there is a strong belief in local practitioners regardless of their qualifications, but this can lead people to accept anyone as a doctor. Therefore, trust can sometimes overshadow the need for credentials. The legal penalties for practicing medicine without a license are often not strong enough to stop fraudsters, but this lack of enforcement allows fake doctors to continue their practices. Therefore, the risk of getting caught is low.
A lot of doctors, real ones, stopped their private clinics amid second COVID surge.
हाँ, यहाँ का प्राइवेट जो हॉस्पिटल है सब क्लिनिक बंद है यहाँ पे.
The rise of telemedicine and online consultations has made it easier for fake doctors to reach patients without being physically checked. But this can lead to more cases of fraud. Therefore, patients must be cautious when seeking online medical advice. Why do Indians visit a fake doctor even if they know they are fake?
Medical colleges. There aren't enough of them. India needs more colleges and more doctors. It's a bit of a vicious cycle. The government tries to increase the number of seats in MBBS courses, but who is going to train these extra students? There are not enough teachers to ensure quality education. Sample these numbers. According to a recent report by the Ministry of Health and Family Welfare, rural community health centers, or CHCs, face a huge shortfall of specialist doctors, but there are only 4,400 specialists available when there should be about 21,000. Therefore, this means there's a deficit of over 17,000 specialists, including surgeons, physicians, gynecologists, and pediatricians. The situation at primary health centers, PHCs, is also very concerning. Many of these centers operate without enough medical staff, but in 2021, the percentage of PHCs without doctors rose to 21% compared to 17% in 2005. Therefore, this shows a growing problem in rural healthcare.
In India specifically, it's really sad that 60% of our population is in rural India, but only 30% of our doctors work there. So there's a definite need in rural India right now, not just for doctors, but for healthcare professionals.
Rural areas have about 68 to 71% of India's population, but they are only served by 34% of the country's doctors. This inequality highlights systematic issues in healthcare distribution, but it also shows that many people in rural areas do not have access to proper medical care. Many doctors do not want to work in rural areas, but this is often due to perceived disadvantages like lower pay, fewer job opportunities, and poor infrastructure. Therefore, the lack of incentives makes it hard to attract doctors to these regions. Many people in rural areas cannot afford treatment from licensed doctors or hospitals, but these often charge higher fees. Fake doctors, on the other hand, often offer services at much lower prices, making them appealing to those with limited financial resources.
But the 2019-2020 rural health statistics show there is a shortfall of 69.7% where obstetricians and gynecologists are concerned, and there are 78.2% fewer pediatricians than there should be.
Licensed medical practitioners usually charge between 200 rupees to 2,000 rupees for consultations, but fake doctors typically charge much lower fees, generally between 50 rupees to 100 rupees. Therefore, in some cases, a fake doctor might charge as little as 10 rupees for consultations and treatments. In many communities, fake doctors are known and may have built trust with local residents. They often start by treating minor ailments, but this can lead people to overlook their lack of formal qualifications. Therefore, individuals facing health issues may prioritize immediate relief over the legitimacy of the practitioner.
We know we don't have enough doctors in rural areas, and we've relied throughout on people who call themselves doctors, who are what unfortunately are often called Bengali doctors, which means they are not actually qualified. That's a Bengali doctor in Rajasthan. It's people with no degrees whatsoever. And so these people, they provide most of the healthcare. 80% of the first visit in rural India are to these people, and 80% of them have no qualifications whatsoever.
The promise of quick fixes or magic treatments can be very appealing, especially when conventional medicine has not helped them. However, the regulatory framework in India is weak, allowing individuals without proper medical education to to operate clinics and treat patients. This lack of oversight enables unqualified practitioners to thrive, often appearing as legitimate doctors. In conclusion, the choice to visit a fake doctor is often driven by necessity rather than ignorance. Patients in rural India face a serious lack of accessible healthcare options, but economic constraints lead them to rely on unqualified individuals. How do fake doctors evade detection in India? Many fake doctors create or buy fake medical degrees and licenses, but this makes it hard for patients and authorities to check their qualifications. They may use names that sound like real doctors' names, therefore confusing patients and avoiding scrutiny.
BIMS, electro-homeopathy. These were just some of the strange medical degrees we spotted in our travels in Madhya Pradesh and West Bengal. Degrees that many claim give them valid license for medical practice. But these are fake. None of them recognized by the government or the World Health Organization. Regardless, the practice isn't fake.
Fake doctors often work in rural or underserved areas, but these places usually have less regulatory oversight and a high demand for healthcare. By becoming part of local communities, they build trust, therefore making it less likely for patients to question their credentials. The laws that govern medical practice are not enforced well enough, but this allows fake doctors to operate without fear of getting caught. Regulatory bodies may lack the resources or training to effectively identify these fraudulent practitioners.
Central Investigation Bureau has arrested 36 doctors allegedly for holding forged certificates from Bihar. The arrested doctors were working in different hospitals in Nepal. After India Today exposed Bihar's education scam, the Nepal government initiated an inquiry into certificates issued from Bihar to people living in border towns in India and in Nepal. The CIB Nepal presented the doctors who used fake academic credentials at Kathmandu District Court, seeking judicial remand for further investigations.
By offering services at lower prices than real doctors, they attract patients who are desperate for affordable healthcare. Some may even provide free consultations or treatments to gain trust and build a patient base. Additionally, with the rise of telemedicine, fake doctors can reach patients without needing to be physically present, therefore making it harder to detect them. They often use social media to promote their services, appearing legitimate through their online presence. Satisfied patients may recommend them to others, which creates a network of trust that complicates detection efforts. Engaging in local events or health camps also boosts credibility with communities. The lack of clear definitions about what counts as medical practice allows some of these fake doctors to operate in legal gray areas. Bribery or corruption within regulatory bodies can enable them to continue practicing without facing penalties. Addressing these issues requires a comprehensive approach, therefore involving stricter regulations, increased public awareness, and better monitoring by authorities to protect patients from fraudulent medical practices. Which states have the most number of fake doctors in India? It is hard to say which states have the most fake doctors, but many cases go unreported. Therefore, it's difficult to get accurate numbers. In Delhi, there are about 565 fake doctors as reported by the Delhi Medical Council, but no action has been taken against them despite numerous complaints. Therefore, some estimates suggest that the real number of fake doctors could be as high as 50,000. Karnataka has approximately 1,700 fake doctors identified, but these are mainly found in the Ayush sector, which includes Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy. In West Bengal, the Criminal Investigation Department, CID, has found over 500 fake doctors, but they operate in both government and private sector healthcare settings, therefore raising concerns about patient safety. In Telangana, the situation is also alarming. In Khammam district alone, the Telangana State Medical Council identified 122 fake doctors during recent inspections, but this may just be the tip of the iceberg. The actual number of fake doctors could be much higher than reported. How to tackle the 1 million fake doctor problem? It is clear that the current legal framework for prosecuting medical fraud isn't working, but the existence of 1 million fake doctors proves this failure. Therefore, we must increase the availability of qualified doctors across the country, especially in rural areas. However, this increase cannot happen without a compulsory rural service requirement for all MBBS graduates. Therefore, we should build neighborhood clinics for every 1,000 residents. But this initiative must be supported by better pay and improved infrastructure.
The Criminal Investigation Department of West Bengal Police began its probe 3 months ago after complaints. It is still to figure out how this fake doctor of Howrah, Shubhendu Bhattacharya, got an award from the president himself.
Moreover, the level of service and the availability of doctors should be such that it wouldn't make sense for a quack to set up a fake hospital. However, to achieve this, we must also crack down on individuals issuing fake degrees. Therefore, we need very strong laws against those posing as doctors, but there must also be widespread campaigns to educate locals about the legitimate services available to them through the government.
That's right, Amitabh. In fact, the 3 doctors that we exposed, one of them being Jin Saxena, but you can't call him a doctor anymore because now the MCI investigation showed that he actually is not a prescribed and authorized, not an authorized doctor at all. The degrees and the certificates that he showed the MCI turned out to be all fraudulent.
India's healthcare system has changed a lot over the years, but there are still many problems. The number of doctors has increased significantly, but there are still issues with their distribution, especially in rural areas. Hospitals have also grown, but this growth is not equal across all regions. Therefore, while there is progress, access to healthcare remains a challenge for many people. The government is trying to improve healthcare by investing more money and building new facilities. But despite these efforts, many rural areas still lack proper healthcare services, which makes it hard for people to get the help they need. Therefore, even though the healthcare landscape is evolving, significant gaps in access and quality still exist. So what do you know about India's healthcare system? And what are your tips to improve it? Let me know in the comments. Thanks for watching.